Hello, everyone. So, this winter is going to be a marathon, definitely not a sprint. So, we're in for the long haul. Today, we're going to talk about what happens if you were exposed to a COVID positive person, or if you are a COVID positive person or one of your children. My name is Dr. Noha Polak from Progressive Pediatrics in Union City and Bayonne, New Jersey. And I'm here to communicate with you what's happening in our community this week. In our practice, we have been taking care of many patients that have been exposed to COVID-19 over Thanksgiving. When they call us, we usually triage them. We talk to them first. They don't all need to come into the office, and often we do a televisit with them, and then we can test them in their car, or we can test them in a separate room that we have only for that purpose so that we don't expose anyone else. We are wearing a lot of PPE to protect ourselves and our patients. So you're safe here. So let's answer the question. After Thanksgiving, a bunch of people decided to get together, and then there were lots of COVID infections. And so some people got tested at urgent care centers, some people decided to get tested at our location. And the bottom line is this: if you were exposed to someone who is COVID positive and you were indoors with them, speaking with them, if they're part of your immediate family or part of your extended family, then whether you test positive or negative, you must quarantine for 14 days. So the difference between isolation and quarantine are: if you are a COVID positive person, you must isolate yourself from everyone else in your household, if possible, for a total of 10 days. If you have been exposed to a person who is positive, but you yourself don't know, or you yourself are negative, you still must quarantine for a total of 14 days. If you are positive, what do you do to take care of yourself as a parent? Please stay home. If it's possible, have someone else take care of the small children. If it's not possible, wear a mask at all times in your own household, especially if you cannot isolate within the household itself. If you have separate bathrooms, that would be great. If not, you have to clean the bathroom with sanitizing wipes after every use, especially the sink and the doorknobs and the handles in the bathroom, to keep everyone else safe. So are there medications out there for COVID? The answer is not for the outpatient. If you're in a hospital, there are medications, but there's nothing that we as primary care providers can send to the pharmacy to help you with that. You can treat fever and fatigue if you need with Tylenol or Motrin, lots of clear fluids, and eating healthy foods and rest. However, there's nothing that we can give you or your children to get rid of COVID. Some patients are getting antibiotics from their adult doctors and thinking that I can also prescribe antibiotics for the children, but the bottom line is antibiotics are for bacteria. And unless I think there's a bacteria, I will not be prescribing an antibiotic for COVID because it's a viral infection. The great majority of the children who tested positive have had very minimal symptoms. Some have cough, runny nose, and fatigue. A few of them have had a couple of days of low-grade temperature, 100 or 101. The great majority are not very sick at all, and they recover very quickly. Usually the parents are tired and having symptoms for longer than the children. So I just wanted to make it clear. If you were exposed, you can get tested if you simply want to know, but you don't need to. You have to quarantine for 14 days, regardless of whether you have a positive or a negative test. So lastly, I want to talk a little bit about COVID fatigue. I definitely have COVID fatigue, and I think our entire community has COVID fatigue. So we're tired of hearing about it, we're tired of seeing it, we're tired of talking about it. So how do we handle this? Honestly, we need each other. You guys really give me the energy to keep going. When I come into the office and I see teenagers who are so sad and lonely and depressed, that gives me the drive to keep going, to help them, to help address their issues and their loneliness. So if that's your case, you're not alone. Lots of teenagers are suffering greatly right now from being isolated from their friends and from not going to school. When I see a parent who's working super hard at Costco or in a supermarket, and they have to also take care of their children, and they have so many different difficult decisions to make, you guys give us in our practice energy and reason to keep going. So we are there. We're there to help you with your struggles, whether they're medical, emotional, psychological. We will do whatever it takes to help everyone get through this. We are using the most safe techniques there are. We have HEPA filters to filter each room after patients. We have a lot of sanitizing wipes that we're using, and we wear full PPE in our practice. So bottom line is this: the CDC and the health department and the school nurses are not all following the same guidelines. So I wanted to tell you the guidelines that we are following in our practice. If you're positive, isolate from everyone for 10 days. If you have been exposed, quarantine for 14 days from your last isolation. If you live with someone who is positive and you yourself are negative, you still have to quarantine for 14 days from the last time that you were with that positive person. So if you live with them, then that's 10 days of isolation for them, plus 14 days of quarantine for you, which seems a lot, but that's how we protect our community. Yes, there are many gray zones, and we can help you walk through them if you call us for a televisit. We will do our best. So we're doing our best to keep our spirits up. Please help us keep our spirits up. Call us if you need us, and we're there for you at Progressive Pediatrics. If you like this video, please share it with your family and friends. We're here for the whole community. Progressive Pediatrics in Union City, in Bayonne, New Jersey.